I've had a look at your appraisal folder and the evidence that you've submitted, and I can see that your main job is a partner in general practice, but you've got a few outside roles. I just wonder if I could talk to you a bit about those.
Of course.
You mentioned that you work in the dermatology department.
Yes, I'm a hospital practitioner in dermatology, and really what I mostly do is deal with hands-on minor surgery.
Okay. And how do you keep up to date with that?
Well, I mean, first of all, by practice. You know, I'm constantly in contact with the consultant in the clinic, particularly around recognising lesions, planning how we excise lesions, or even short of that, how we sort of manage lesions non-surgically. I've been to a couple of conferences which are in my appraisal folder. I found those very, very helpful. Few learning points that I've highlighted in there, but really demonstrated to me that my surgical techniques are sort of up to date. I did a minor surgery course and didn't really learn very much apart from the fact that I appear to be doing most things correctly. It was very interesting, and it sort of confirmed my practice to me.
I can see that you've put some CPD relevant to that role there.
Yeah.
And I feel quite comfortable as an appraiser in sort of verifying the CPD and then seeing that you are keeping up to date.
Thank you.
Every appraiser is different, and so the next appraiser that you see may not have as much experience in dermatology as I have.
Right.
And I think that for revalidation purposes, we're looking to see that how you qualify for a role, how you're keeping up to date, how you monitor quality. Because you're working in a dermatology department, you've probably got a supervisor or
Well, I work closely with the consultant, yes.
I think, you know, for appraisal revalidation purposes, as well as keeping a record of how you keep up to date, it'd be quite useful to get a review letter from this consultant. And I've got a template here, which is quite a simple template, but it just gives you an idea of what the consultant needs to say about you. And I think that would be very useful for your next appraisal.
I don't think there'd be any problem with that at all, thank you.
So, but I would continue to do the CPD that you do in that role. I would get the consultant to write the letter and just basically saying that they're happy with the work that you do. I would think a little bit about the quality issues. Right, you've done some CPD, but maybe some quality audits or significant event analysis. I'd look a little bit about that. And what I'll do is I'll put a PDP entry in your appraisal form relating to this role.
Yeah, I quite easily look at infection rates because we record that. We don't tend to get that many significant events. I suppose an unexpected malignancy might be we get those from time to time, as everybody does. So I'll think about looking at those and see whether I could go into discussion perhaps with my consultant who helps me with the diagnosis, and see if that's, I can look at that.
Yeah, I mean, the important thing about significant events is the discussion. It's the reflection on the discussion as to what happened and how maybe things could change for next time.
Sure. Okay.
I'm
Well,
happy with that.
I'm happy with
So
that.
I'll put a letter, I'll put a PDP entry in.
Great.
There's also one other role that you do. It's something about working for a rugby club.
Yeah, I'm the team doctor for one of our semi-professional rugby clubs. It's a paid role. And basically I turn up on training days and match days and provide the medical cover. We have a physiotherapist as well that assists me. And so I deal with suturing wounds, for instance, and that's probably the most common thing that I do. And with my dermatology role, the minor surgery course, that's sort of fairly straightforward. You know, we do sometimes get more serious injuries. Broken bones are not that uncommon. Okay. And of course, concussions and unconscious patients happen, fortunately rarely, but you know, still I'm called to do on-field duties, and it's hairy sometimes.
Right, okay.
But you know, I thoroughly enjoy it. I enjoy the rugby anyway. But you know, it's mixing sort of professional and social sides of things.
Compared to what you do in the dermatology clinic, I seem to have less experience with this type of role. So for me, I would find it quite difficult to know what exactly you're doing and what you're doing. So for revalidation, very similar sort of principles really, that they would like you to know how did you qualify for this role, how do you keep up to date, how do you monitor your quality. So I can't see a lot of evidence about that in the appraisal folder.
No, okay. I mean, I suppose a lot of it's historic. I mean, I did quite a lot of casualty when I was training, and I've got my ATLS, which I did last year, so it's not in the folder this year.
Okay.
Which really is a requirement for the work that I do. I really do.
How long does the ATLS stand? What is the ATLS?
ATLS is the Advanced Trauma Life Saving.
Right. How long is
life
that?
support? Sorry. How long is the?
Is it a yearly requirement or 3
I
yearly?
probably should be doing it annually.
Okay.
There's no actual requirement on the role that I take, but I think from a professional point of view, I should probably be doing it at least every other year. I'm thinking about doing it again.
I think, with the type of injuries that you've mentioned and the fact that you get paid for it as well, it is a professional role, and you would have to sort of make sure that you're keeping up to date and looking at quality issues in that role. Can you think of any ways you could do that?
I've been thinking about this ever since we sort of started with the revalidation process, and it's been a little bit of a thorn in my side from the point of view of having a GP appraiser and them not quite understanding the role that I take. I was actually appraised a couple of years back by somebody who does something very similar, and we talked about this, and we said, oh, well, this is what we do, but I suppose that's not good enough for revalidation.
I think, if you're getting together with like-minded colleagues and you're looking at what you do as a professional, and then you're reflecting on what you've done, and you're looking at quality issues, I think that would be a useful way to go forward.
Yeah, and I'm certain that the WRU would be very supportive of us as doctors on the touchline, meeting up. And you mentioned significant events again, and quality improvement. I mean, I think quality improvement is slightly difficult because they're episodic occurrences that you don't know what's going to happen. I mean, I suppose I could look again at infection rates in my suturing. I'm not sure that's quite so relevant with the rugby because they're usually dirty wounds anyway, and although we clean them out.
It's a question of looking at things.
Yeah,
and I think that if you could get a group of supportive people and also look at the WRU to see what support they can provide, I think that would be useful for your next appraisal process.
And I suppose thinking about that, we could actually discuss significant incidents, because we've all got the unconscious patient that was unconscious when they left in the ambulance, and that is really quite significant, or an unusual fracture.
That would be a very useful thing to do.
I'd be quite happy to do that. I know a lot of these doctors, obviously, because when our teams play each other, we have a get-together and a chat about the game. So I don't think that would be difficult to arrange for me.
What I need to do to move forward to next year is I don't have as much experience in this role as I did in the dermatology role. So I need to give you a WP1 letter.
Okay. What's that?
I've got a copy of it here. What it does, it tells you what you need to do for next year.
All right, okay.
So that this role is covered.
Okay, and that will cover me for revalidation then?
That's right, yes. So what it does is I'll put this again in your PDP that you've had a WP1 letter in this role. And it's again about looking at how you qualified in it, how you're keeping up to date, how you're looking at the quality issues. And some of the things you just mentioned about getting together with other like-minded people doing the same role, and all together, getting together to see how can we demonstrate these factors. There's also some very good guidance on the Revalidation Wales website about whole practice appraisal.
Right.
So that's looking at your other roles apart from your mainstream general practice.
Where do I find that?
It's on the DNV website, the whole practice, Revalidation Wales website.
Revalidation Wales, okay.
I can give you I can put that into your PDP. I'll put
great.
at your website
Thank you.
URL there. But if you look at that and you look at what the WP1 letter says and follow that, that should be fine for next year.
Okay, well, that sounds fine. I've been worried about this for a while, but I'm sure my other colleagues
they're all in the same position.
position.
If you get together and you think about,
yeah.
if you think about how you apply some of the principles about CPD and quality in mainstream general practice and dermatology, and try and see how you could apply them in this role.
Yeah. Okay. Thank you very much.